I'm Dr. Steve Weiner from the Aesthetic Clinique, and this portion of our program we're going to talk about Artefill. Artefill is a more or less permanent filler. It's a combination of collagen, which gets removed by the body in about 3-4 weeks, and PMMA, polymethyl methacrylate. PMMA in Artefill is tiny spherical balls that are approximately the size of a white blood cell. And what they do is when they get injected into the patient, they stimulate the patient's own collagen. But the body cannot degrade that PMMA, and so the collagen is continually stimulated, and so you have a permanent result. There are studies that show 5 years actually improvement from the 1-year result to the 5 years. So you actually get continued stimulation of collagen. You do age, and some people will need touch-ups along the way. So PMMA is a long-standing product that has been used in medicine for 50 years or more. Its first use was in cranial injuries where the skull was missing and they had to recreate bones, so they used it that way. But it's also been used in oral surgery instances as well. So what Sandy has been doing has been cooling Janice down. This is a cooling device that numbs the patient fairly significantly without the use of topical anesthetics. The reason I prefer this is because it actually goes a lot deeper. The topicals only get the surface. This can get all the way down to where I'm going. So we prepped the area significantly well. We're fastidious regarding sterility with a permanent filler, so we use a HIPAA, which is a hospital-grade soap. And I always use blunt cannulas when I do Artefill, and blunt cannulas decrease the trauma to the tissue, decrease the amount of bruising, the swelling, and the discomfort to the patient's a lot less too, because all I do is enter through one point and get all the area of the upper cheek through just one insertion site. This product also contains lidocaine, so it's a fairly comfortable procedure. The collagen in it prevents a lot of swelling and bleeding as well, and so there's very little swelling or bleeding after this procedure. Janice has had a kit of Artefill on her approximately 3 months ago, and the kit is 5 syringes. And we did her upper cheeks and we did her marionettes. She needs a little bit of a touch-up right now to complete the process, and that's typical. You don't want to go all the way. You kind of go 3/4, see how the body reacts, and then go the rest. One thing to mention is because the collagen is not human, it's made, we have to test this collagen to see if they are allergic to it or not. So all patients need to get a skin test on their arms approximately 3 to 4 weeks before they get the procedure done. And so we're going to put a little bit of Artefill right in there. She's doing great. Once we start injecting, she gets pretty numb. And there you go. We've injected this upper cheek and tear trough area with the Artefill. It's a fairly comfortable, quick procedure. It's the same procedure I do with Restylane, Juvederm, Voluma. But what I wanted to really point out is the Artefill is the permanent solution that you now have when you do Artefill. There's only very few providers that are actually approved by the company to do this procedure because it is permanent. They want good results. They don't want to have people that have results done by non-experienced injectors. So if you want more information about Artefill, please see my website at theclinique.net. or give us a call at 850-622-1214. Thank you. Okay, so I just wanted to show you our finished product. We had 3 syringes injected, inner cheeks, in her marionette area, and in her preauricular area as well. So as you can see, there's no bleeding, no bruising, no swelling. It's a great product, this Artefill. And if you're tired of getting all those injections, Artefill is your answer. We can inject Artefill in the temples, into the cheeks, we can't inject it into the lips, but in the marionette, the jawline, preauricular area. So it's a great product to use for permanent results. Now you're still going to age, so you're still going to need Artefill down the road. So if you want any more assistance, look at our website, theclinique.net, or give us a call at 850-622-1214. Thanks.